afternoon. My name is Corina Evalora, and I am the Public Information Officer here for the Santa Clara County Emergency Operations Center. Today, we have our Dr. Gerardo Solorio-Cortez here, but before I introduce him and bring him in, I'm going to give my short, brief presentation. So, Gloria, if you can please help us out with the presentation. Thank you so much. Actually, it's our other one. Dr. Gerardo Solorio-Cortez will be doing an update for us on the vaccines for children. So if we can queue up the other general information, and if we're not ready for that, please let me know and we can bring Dr. Gerardo Solorio-Cortez up first, and that would be fine. So it's up to you, Gloria. If you want to cue in Dr. Gerardo Solorio-Cortez, I know he's ready to go. If you have that presentation, and then while you queue up the other one. Thank you so much. Welcome, Dr. Solorio-Cortez, again on our biweekly community forum, but monthly community forum with you. I'm going to turn it over to you, Dr. Gerardo Solorio-Cortez. I understand that Gloria has your presentation queued up, and you'll be updating us on our 5 to 11-year-old vaccines here in our county. As soon as I see Gloria, I know she had that presentation ready to go, so we'll just, it looks like she might have gotten the other one. So whatever she queues up, we're ready to do this. All right. Let's see. Go to the next one. Next slide. Okay. All right. So I'll give my general update and then we'll bring you back in. Thank you so much. So just want to give an update. Let me see. I don't know that this is it. Go to the next slide, Gloria. Is this the one we reviewed? Okay. Yeah, let's start there. The vaccines for the kids, as we know, Dr. Gerardo Solorio-Cortez will be giving the details on this. But just reminding parents that everyone now ages 5 and up are eligible for a vaccine. They are free and available at all of our sites here in Santa Clara County. And Dr. Solorio-Cortez will be going more into detail with these. Next slide, please. And in regards to what to expect, make sure that you bring your children's vaccine records cards. Most of us as parents have that yellow long card or white. And now I think at Kaiser, they're giving an actual printout. So just bring your vaccine card if you do have it. Don't worry if you don't have it. I know some of us are like, oh, maybe I have to cancel because I don't have it. No, do not cancel your appointments. If you can't find it, make sure you go to your appointment and they will be able to provide you with a card. And then later add it to that long vaccine record. So make sure to follow through with your appointments. Even if you can't find this card, still make your appointment. Next slide, please. And some common side effects, you can see them on here. The doctor will go more into detail with them. I'm trying to save time with me so that we all have more time with the doctor. I know some of us parents are anxiously, waiting to speak to a doctor, and we have him available. So next slide, please. I'll let him go over those side effects. And where can you get your booster shots? As we know, some of us heard today, we had a press conference. Dr. Sarah Cody came out and Dr. Marty is reminding all of us to get our booster shots. Obviously, those of us who still don't have the vaccine, make sure to get your vaccine. We know that they don't come into effect until you have the second dose, right? Fully. If you haven't gotten it until you have that second dose, and then 2 weeks after that. Same thing for your booster. Once you have your booster, we have to wait 2 weeks before it fully protects us. And then also our children, right? Once they get vaccinated, they do need 2 doses, and the doctor will go over that. But I'm saying this because the holidays are coming. We all have been waiting anxiously to celebrate, whether it's, Thanksgiving, Christmas, New Year's, to be with our families. And so we need to keep in mind the calendar, keep in mind the, time frame, make our appointments now, get our vaccines as soon as possible so that we can be fully protected once that time comes around and we're able to be around our families. And if you can go back to, I just want to review a little bit about the booster and who's available for the booster shots. And it's those 18 and over. If you can go back to the previous slide. Sorry, Gloria. Thank you for your help in the background. If you're able to go back. But basically, anybody 18 and older, those that are having immunocompromised and then are working with the public in one way, shape, or form. So if you work at a grocery store, for example, you are available to get your booster shot if you're 18 and older, and you've got had your either Pfizer or Moderna or your vaccine 6 months ago. So if that qualifies you, if that's where you're at, make sure to get your appointment done. Make sure to go get it. And then this one, again, vaccines for everyone 5 and older. These are some sites that we have. So as we all know, Santa Clara County Fairgrounds, Expo Hall, and the Emmanuel Baptist Church. They're available there. And in South County, we have DePaul Health Center and the San Martin Vaccination Clinic. Again, these are just a couple of many sites that we have throughout our county. And then in Mountain View, we have the Mountain View Community Center. And all of these sites are offering evenings and weekend appointments. So these specific sites are the evenings and weekend appointments. The other sites might not have them. So if you want to jot these down, great to have it. You can make your appointment on secfreevax.org or call 408-970-2999 or call 211. Next slide, please. And then just some resources, reminders. You never know when you might need them. Again, that COVID test or vaccine appointments, 211, or any general information that can guide you to what you might need. Mental health services, 1-800-704-0900. Know your rights in the workplace, 1-866-870-7725. Substance use services, 1-800-488-9919. COVID support line, the 408-808-7770. And then the crisis hotline 24/7, 1-855-278-4204. Or you can text RENEW or 741-741. And thank you so much. And now, thank you, Gloria. If you can cue us up for Dr. Solorio-Cortez's presentation. Thank you for being in the background and setting us up so that we're able to just show up and speak. We appreciate your work, Gloria, one of our public information officers as well in our group, doing amazing work to ensure that we're able to bring this information to you all. So I'm going to bring back Dr. Solorio-Cortez. Welcome back. And he is here. Gloria has the presentation ready to go. Thank you so much. He's a primary care physician for internal medicine, and he's at the Valley Health Center based out of Gilroy. And thank you so much again for doing the work you do in our community, Dr. Solorio-Cortez. So I'm going to turn it over to you to update us on what's going on for our 5 to 11-year-olds.
Thank you again, Karina and Gloria. Audience, welcome again to our forum, and I'm happy to have you all here today. And yes, today I think we would like to focus on the vaccines for our children ages from 5 to 11. As Karina has mentioned, I am a primary care doctor in internal medicine at Valley Health Center in Gilroy. Next, please. So by now, you know, and you've seen in the news, and we've promoted on our social media and websites that the Pfizer COVID-19 vaccine has been approved for the ages of children from 5 to 11 years old. You can see the progression or the timeline of when and how the vaccine was approved. You can see that it was started on October 22nd, and last week approved around November 3rd, 4th for full approval to be given to 5 to 11 years old. Next slide, please. You know, a big question that we get is, you know, how different is this from the regular adult COVID vaccine? And there's two major differences. The dose, it's 1/3 the dose of the adult dose. The adult dose is 30 micrograms, for children, it's going to be 10 micrograms. Also, a big difference is the color of the vial, the vaccine vial, and in the next slides we will see that there's a difference. So it kind of, in a way to ease some worry from people in terms of how do we know that this dose is the child dose, and the color is going to signify that too as well. Similar to the adult dose, the separation between the first and second dose is going to be 21 days. And as this slide shows, this is the color of the vial. Again, it's different from the adult dose vial. Next slide, please. A big question is going to be, so what are the side effects? Are they different from the adults? So the study that was done through Pfizer, currently, 4,000 children. They looked at those who got the vaccine and those who didn't, pretty much the placebo or water vaccine, just to see differences or the side effects of what the children got once the vaccine was given. And pretty much is very similar to the adult studies and what we've seen in adults now that we rolled out the vaccine for many months, which is the main side effects or symptoms are pain at the injection site, redness, and swelling. And there can also be more of a body symptoms, which would include fever, chills, muscle pain, headache, tiredness. Very similar symptoms to the adult population, and very similar to the adult population. These symptoms last at most 48 hours or 2 days. Next slide, please. So like I said, the key points is it's 2 doses of the Pfizer vaccine. The amount is different. It's 1/3, and as similar to the adult population, studies that have been done that Pfizer did and that was vetted, basically looked at by the CDC and the FDA, shows that it's safe and very effective vaccine. And as Corina mentioned, to be fully vaccinated with the child COVID vaccine, it's going to be 2 weeks after the second dose that is given, similar to the other doses, the other adult doses, which are the Pfizer, Moderna, and Johnson & Johnson, Janssen vaccines. Next slide, please. The biggest difference when it comes to the rollout, the adult population to this children population is the different ways that we're going to be able to vaccinate children. One of the most simplest ways is, of course, doing it at the school districts or at school level, because that's where we could get the child to get vaccinated. So please look out for your local school district processes when it comes to vaccination. I know the county on their website has information about that as well. So county and specifically Santa County, working along with school districts, are going to set up vaccination sites within their schools so that children get vaccinated. And of course, being children, we want to make it as convenient, safe as possible. So try to ease the anxiety, angst. So there's different ways that the school districts are going to tackle that issue and make it more comfortable for the children. Next slide, please. Like I said, different locations for the vaccination sites, which would include retail pharmacies, school sites, as mentioned, county locations, as Corina has mentioned, for example, the DePaul Center and San Martin Center here in South County. And also, of course, your healthcare provider. Actually, it brings me to a good point that I want to make, that this vaccine is going to be more friendly with regular refrigerators. So local pediatricians are going to, or your local uh, primary care pediatrician is going to be able to um, carry these vaccines, because no longer will they need this ultra frozen refrigerator that they'll need for the Pfizer vaccine, which is needed for the adult dose. Now, for the child dose, the new formulation made it possible that regular refrigerators are going to be capable of having these vaccines. So it makes it easier access for someone that wants to get their vaccine with their local uh, pediatrician who knows them well. And like I said, I mentioned, Corina, the different resources. Also, if you need someone needs a ride to the vaccination clinic, you can see there's a phone number, 408-809-2124, to help you out with that transportation. Next slide, please. Um, Frequently asked questions. I believe this is the whole purpose of this forum, is for the community to ask their questions, concerns. Very similar. I think I would just mention three of them for the sake of time. One of them being, my child already had COVID-19. Do they still need it? And very similar to the adult population, studies have been done. And more recently, an adult study was done that looked at people that had previous infection with COVID, then were vaccinated. And then they compared that group to people that had infection, were not vaccinated. And then they looked at the antibody levels 3 to 6 months later. And it turns out that there was a more robust, or mean a better protection for people that were vaccinated, even though they had COVID infection months or year ago. So the CDC, FDA, and local authorities, communities, doctors, we still recommend, even if a child has been infected with COVID in the past and they meet criteria, meaning from age 5 to 11, and now five on up, they do meet criteria for vaccination. Another big question, which will be, I heard this will cause problems with fertility later in life. The current studies do not prove that. There's been no evidence to show that there's decreased fertility, for example, in the adult population that's been vaccinated now, going on 8-9 months. So that's according to the data, science, it's not true. A big question, and I'll end up these questions with the question being, I heard there were heart problems because of the vaccine. And I think this is an important point to point out. And what we're talking about is myocarditis. This is the condition where the heart gets inflamed, not only because of vaccines, but also of other reasons. Medications, for example, would cause inflammation of the heart. But we know studies were done in the for example, the 16 to 24 population of Pfizer and Moderna, and specifically it was male young population, 16 to 25, who had more cases of myocarditis. So the FDA and CDC, if you look at the public meetings, you could see that there was debate over this, and the concern is how big of a problem is this myocarditis, and would this be a reason not to vaccinate children between 5 to 11, because we see these cases between 16 and 25? And the answer is no. So we looked at all that data, and the benefit, meaning the benefit of being vaccinated and preventing COVID, disease, the acute infection, meaning the fever, the cough that happens now, and also the long-term symptoms of COVID. Taking all that into totality, the CDC, FDA came to the conclusion that the benefit, even knowing the very low risk of this myocarditis condition, the benefits outweigh that risk. So we still recommend it. But and also this is another important point to make is, even with all this, the vaccination started, the CDC and FDA have a very robust web-based system, and also clinic-based system, where if we see more cases of certain conditions, the CDC, FDA will be alerted via these different mechanisms. And an example would be the blood clots that we saw more with the J&J initially, and there was a halt to the vaccine a few months ago. The scientists, the doctors with FDA, CDC sat down and looked at the data and saw if this was a reason to completely stop it. And as it turns out, they looked at the data, and the risk is still there, but very minimal, meaning that the benefit still outweigh the risks with the J&J. So I want to give the audience the basically to have the government and the CDC, FDA are doing their maximum to ensure that the vaccines are safe. Next slide, please. And that is it for my presentation. Of course, if there are any questions, please mention them, and I'm here to answer any questions. Thank you.
Thank you so much, Dr. Gerardo Solorio-Cortez. So as you all heard, let's get our children vaccinated. My 12-year-old, it's been months, so I'm sure we'll hear about the booster shots for that age coming up, soon. So here, looking forward to hear that. All the rest of my family has gotten their boosters by now, so we're just following the directives, and as soon as they allow for us to get them, we're going to be the first ones in line. Dr. Solorio-Cortez, I'm going to go with questions that I see here. Some are comments, some are questions. We have Simon Gordon here, who states, would be great to know how many have taken the 511 so far. So I'm thinking that he's wondering about the vaccines. How many 5 to 11-year-olds have been vaccinated? And I don't know if you have.
No, I agree. And thank you so much for that question, Simon. I was actually, looking at the data, and unfortunately, I try to look for it. I don't think the CDC and FDA has put that out data yet. I foresee in the next few days, similar to the way it was with the adults, they'll start, and then us too, the county will start publishing, how many shots we have given here and also nationally.
Yes, thank you. So we'll be working on that as a county. But yeah, I look forward to seeing those numbers as well. And then we have both Marilyn and Simon as well, who are wondering about the vaccinations at schools or closer to certain homes. And so, as Dr. Solorio-Cortez mentioned, the vaccination team are the ones that have the calendars, that have the staff that are putting them at the various sites. If you can imagine county-wide how many schools there are many. But my understanding is they're going to try to get to the different school, at least districts at different times, have available clinics for evenings and weekends. And if they're not able to get to every school, because not sure that will be a possibility, that they will at least go out to the quadrants or ensure that there's a vaccination site and location near the different areas so families are able to get there. And then, as you all heard, if families do not have transportation, that we have free transportation available to get our families to the different vaccination sites. And then we have Juan Carlos here. He's wondering, doctor, what if I don't want my 7-year-old vaccinated, but mom, big sister, and I are vaccinated?
That's the biggest, I think, point we're making across the, just what's happened with the pandemic and the amount of, disease and the amount of deaths. And then, this past year with December, January, when the vaccine started rolling out. And then if you look at the data of who is infected, who ends up in the hospital, and who most likely ends up, dead, we know that it's the unvaccinated. So point blank, what we're saying is that the vaccinated are protected more than the unvaccinated. So now the 5 to 11, if you meet criteria, we certainly encourage you to get vaccinated. Um, and then I go back to even now, these summers of like July and August, when you just saw anecdotal evidence of people who ended up in the ICU who wished they got vaccinated and they met criteria at that time. Similar to the question you're asking, I'm answering pretty much, honestly, when in terms when what is the difference of being unvaccinated versus unvaccinated? The unvaccinated person is more at risk of getting the infection, ended up in the hospital, and also suffering death. And um, it's any age range where we've seen cases. Of course, yes, when this COVID pandemic started, and you saw how we as a county, as a nation, moved to vaccinate the elderly, the above age 65, because that was highest population that was being and in fact, and compare that population to the younger population, the months to 18 years old. True, there are less cases, but there's been thousands of children being infected with COVID across the United States. And then let me step back as well, that there's the acute infection of COVID, and also there's also long-term COVID, meaning some people have symptoms. So having a child at 7 years old who's running the risk of becoming infected because they're not vaccinated, it's not only the risk of the days of cough, fever, chills that you're going to get, but also subsequently, months from now, how is that long COVID sequela, long-term symptoms that could happen? So that's I think the CDC, FDA pretty much, without a doubt, said that this population should be vaccinated.
Thank you. And then we have Megan E. Flynn, who's wondering how many 5 to 11-year-olds have died from COVID. I don't know if you have any of those numbers. I heard that in the radio, California, but I don't have those numbers right now, but I don't know if you have those numbers available to you. But
Yes, I
I was
do.
surprised because one kid that dies is way too many, right? But when I heard those numbers, I was surprised.
Yes, sorry, it's I'm thinking it's less than a thousand.
And no worries if you don't have him, doctor. We can get him the specific numbers for the following community forum.
A total across the United States, a total of 700 kids, children less than 18 years old since the pandemic started. 8,300 hospitalizations, um, specifically, and then for the specific 5 to 11 age range, 100 since the pandemic started. And this data is from like 2 weeks ago. So total less than 18 years old, 700 across the United States. And specifically, how many infections between 5 and 11 years old? We're talking about 2 million cases across the United States, 2 million cases, and 100 deaths.
Mm, thank you. Those numbers are powerful because even one death is too many. So yeah, 100 is way too many. And it shows, right, that our children are dying from COVID.
Yes.
Okay, and then we have Erika Rico here, who is wondering, hello, Dr. Solorio, will kids also need a booster 6 months from now?
It's a very good question, Erica, and thank you so much. We don't know yet at this point, and it's similar. Take us back to January and February, when we knew about Moderna and Pfizer and Johnson, and just doing that series, and then recently now in September, October, studies started coming out saying that the antibodies wane your defense system of your white blood cells, the system that fights disease. They kind of lessen through time. So this is where the recommendation of the booster came. So we just need to wait and see what happens in the next few months. I foresee that maybe we will need it, similar, because it's what happened with the adult dose. And let me step back too. Many scientists also, felt back then that this vaccine was going to be like a 3 vaccine booster, just because the 21 days and 28 days wasn't enough, but because even at this moment, we want to vaccinate safely and as soon as possible. That's what we're doing, the 21 days. But foreseeable that in the future, most likely you will need a booster. But excellent question.
Thank you. And then we have TV Real Alarcon. Will there be a booster for 12 and older kids that are at high risk?
Excellent question. That's a very good question. So what I do know from the CDC and FDA, for example, let's say we have a 13-year-old child who's going through chemotherapy for X condition, whatever disease, cancer. The CDC, FDA says that at this point, we do recommend for them to have a 3 vaccine series, for example. And it's going to be a small population, and I'm talking about specifically for example, a child who's 13 years old and is going through chemotherapy. So at this point, that's already recommended. Now, the larger population, for example, the 13-year-old who has, for example, obesity, hypertension, or none of the other high-risk cancer conditions, at this point, they're not recommending yet, CDC and FDA, from my understanding.
Okay.
And lastly, what I would say is, of course, talking to your healthcare clinician, because it is, I would say, a little bit confusing when it comes to the dose, who's at high risk, who's not. So I think it's a very good question also to ask your healthcare clinician as well.
Okay. And I think I see one more question on here. And we have more Brill who's wondering the Pfizer Kids clinical trials for 5 to 11 was for a little over 2,000 kids. How is that even close to being enough? I'm assuming is what he's asking.
Yes, that's one of the differences when it came to comparing the amount of participants in the adult vaccines with the Pfizer and Moderna, where we're talking about 30,000, 40,000, and now in children, the trials are more. They basically have the studies run in range between 2,000 and 4,000. One's looking at for example, side effects. The other ones, some of those part studies are looking at the effectiveness and antibody response, which I think is important to point right now. In these studies, the effectiveness was 90%. But yeah, to answer your question, it's transparent. You're right. They were 2,000 children involved, but taking this data and also knowing the emergency that we're going through, meaning that the cases of children were also going up or are going up within this period, and the question is, how do we do it in a effective, safe manner? That's why I also bring up the role of the web-based and also the clinic-based, mentioning or alerting the CDC and FDA if we see certain conditions. For example, if we start seeing more cases of the myocarditis heart condition, I have confidence in our system because it's worked. And if you go to the CDC FDA website, there's actually a way that you could enter your symptoms on a web app, and if CDC FDA starts seeing more certain conditions, we will be alerted. I have a lot of confidence in our mechanisms of protection and monitoring.
Thank you so much, Dr. Solorio-Cortez. I think today, a lot of important information was brought up and good questions. I think very valid concerns from some of us that are parents. And the numbers that you brought up as well, right? Whether it's only been 2,000 that kids that have gone through the
Study.
Pfizer, and then also the 100 kids that have died nationwide, right? And as a parent, then I have that choice right now. Um, to get my child vaccinated. And as a mother, I absolutely got my daughter vaccinated as soon as I could, because I trust, and even in the timeline that you gave, right, from October to November, it was the tail end of that work. But there had been work done prior to. It wasn't just like, let's just throw it out there and let's see what
Mm,
happens.
right.
We waited. We had to wait in order for the children to even get vaccinated. And I mean, us adults, or some of us that got it back in January, right? So it's been 11 months, but we
Hmm.
waited this long because it wasn't safe enough yet for the children. And so I trust, so far my daughter's great. She hasn't gotten COVID. We haven't gotten COVID. And, we're going to do our best to stay safe, especially around the holidays. I look forward to being around my family, in the end of November. We're planning, our trips. And then once December comes around, looking forward to celebrating, this year, in a happy space and
Hmm.
place, because unfortunately last year we lost my uncle to COVID, right? And so
Hmm.
remembering him, of course, and knowing that he would have had his seat there with our family, but that those of us that are here, we're going to do our best to continue to be here and celebrate with one another. Thank you so much, Dr. Gerardo Solorio-Cortez. Thank you for everyone who tuned in today. And know that if you have any Spanish speaking community or families, we do have a 4 o'clock community forum in Spanish. And Dr. Gerardo Solorio Cortez will be available to also answer any questions in Spanish. That will also be a live here on Facebook. And for the rest of you, we'll see you in about 2 weeks. And we'll see Dr. Gerardo Solorio Cortez in about a month. Thank you again and have a great 2 weeks.
Thank you.
Take
Have a
care.
good day. Thank you.